Okay, so my patient has a sacral wound with osteomyelitis due to MRSA. So the precaution I'm choosing to do is contact precaution. So what first I'm going to do is I'm going to hand sanitize. I would ideally like to wash my hands, but hand sanitize is what we have right now. So for contact precaution, what I'm going to do is I'm going to put on a pair of gloves, and then we'll put on our gown, and then another pair of gloves on the outside of that. So we're going to go ahead and put on our gown. Then I would tie the back or have someone tie the back for me. But for the purposes of the video and the time that we have, I'm going to go ahead and just leave it open. So now what we're going to do is put on our second pair of gloves. And we're going to make sure to put these gloves over the wrist of the gown, so that way we can make sure we are fully protected from any contact. If I can get it over. Gloves are always a pain. Okay. Making sure to put it over the wrist of the gown. And then when we are with our patient, if we elect to take the patient out of the room, we would make sure to put a gown and gloves on them as well, so that way we don't have them outside of the room contaminating handrails, whatever it may be, and saving us time from having to go and sanitize it after. But when I'm leaving a patient, I will also take off this first contaminated layer, so that would be the gown and this first set of gloves. Just making sure we're keeping track of what is contaminated and what is not. So then I'll put this into our contaminated area, and I'm free to walk around with the patient with a new set of clean gloves. So then when we take the patient back in, we'll take off their gown and gloves as well. And when I'm done with my patient, I'll make sure to take off these gloves. And then go ahead and throw these away, and then I'd wash my hands, but since we don't have that, I'll go ahead and hand sanitize. Yeah, and then that's it.